Discuss the etiology, clinical features, complications, and investigations and management of obesity. Obesity is defined as an excess of adipose tissue. Obesity is one of the most common disorders in medical practice and among the most frustrating and difficult to manage. Accurate quantification of body fat requires sophisticated techniques, but physical examination is usually sufficient to detect excess body fat. BMI closely correlates with excess adipose tissue, and obesity can be graded based on BMI. Abdominal obesity is a greater health hazard than generalized obesity. Visceral fat within the abdominal cavity is more hazardous to health than subcutaneous fat. Etiology: obesity is the result of an imbalance between daily energy intake and energy expenditure, resulting in excessive weight gain. There are multiple factors which can cause obesity, which are as follows: sedentary lifestyle, dietary factors such as overeating, high fat diet, endocrine disorders, hypothalamic disease, hypothyroidism, Cushing's syndrome, polycystic ovary syndrome, hypogonadism. Social factors: low socioeconomic status, psychiatric disorders, night eating syndrome, binge eating, genetic factors, drugs such as steroids, clozapine, amitriptyline, cryproheptadine, thiazolidinediones. Grading of obesity: BMI 18.5 to 24.9 is normal, 25 to 29.9 is overweight, 30 to 34.9 is mild obesity, 35 to 39.9 is moderate obesity, more than 40 is extreme obesity. Pathophysiology: association of genetics and obesity is already well established. Leptin is an adipocyte hormone which reduces food intake and body weight. Cellular leptin resistance is associated with obesity. Adipose tissue secretes adipokines and free fatty acids, causing systemic inflammation, which causes insulin resistance and decreased triglyceride levels, which subsequently contributes to obesity. Adipocytes have prothrombotic activity, which can increase the risk of strokes. Obesity can cause increased fatty acid deposition in the myocardium, causing left ventricular dysfunction. It has also been shown to alter the renin-angiotensin system, causing increasing salt retention and elevated blood pressure. Adiponectin has insulin sensitizing and anti inflammatory properties, and its levels are low those with visceral obesity. Complications of obesity: hypertension, type 2 diabetes mellitus, hyperlipidemia, coronary artery disease, degenerative joint disease, that is osteoarthritis, increased incidence of cancers, colon, rectum, and prostate in men, uterus, biliary tract, breast, and ovary in women. Thromboembolic disorders, digestive tract diseases such as gallstones, reflux esophagitis, non alcoholic steatohepatitis, that is NASH, obstructive sleep apnea, respiratory failure, Pickwickian syndrome, psychosocial problems, low self esteem, depression, varicose veins. Clinical assessment: history, age of onset, recent weight changes, family history of obesity, cigarette and alcohol use, complete nutrition history, physical activity, sleep patterns, history of any depression and eating disorders. use of any drugs and nutritional supplements, physical examination, degree and distribution of body fat, overall nutritional status, and signs of secondary causes of obesity. Look for any complication of obesity such as hypertension, atherosclerosis, etc. Investigations: blood sugar, lipid profile, urea, creatinine, electrolytes, thyroid function tests, and other endocrine workup is necessary. ECG to look for evidence of coronary artery disease. Treatment: obesity needs multi pronged treatment strategies and may require lifelong treatment. Dietary therapy: low fat, high complex carbohydrate, high fiber diet. Avoid foods with high calories without other nutrients, example fat, sucrose, and alcohol. Exercise: increasing energy expenditure through physical activity helps in losing weight. Aerobic exercise is particularly useful for long term weight maintenance. When compared with no treatment, exercise alone results in a small amounts of weight loss. Exercise plus diet results in a greater weight loss than diet alone. A greater intensity of exercise causes greater amount of weight loss. Up to 1 hour of moderate exercise per day is associated with long term weight maintenance in individuals who have successfully lost weight. Drug therapy. Drug therapy may be considered for those with a BMI greater than 30 or those with BMI more than 27 with comorbid conditions. Obesity drugs may be used as a part of comprehensive weight loss program. Medications for obesity include two major categories: appetite suppressants, anorexians, and gastrointestinal fat blockers. Appetite suppressing medications include phentermine, diethylpropion, and magindrol. Magindol. Two new appetite suppressants have been approved: lorcaserin and phentermine or topiramate. Lorcaserin is a selective 5-HT2C receptor agonist. Phentermine reduces the appetite by satiety center stimulation in hypothalamic and limbic areas of brain. Gastrointestinal fat blockers, orlistat, reduce the absorption of the fat from the gastrointestinal tract. Orlistat can cause diarrhea, oily stools, and reduced absorption of fat soluble vitamins. The recommended dose of orlistat is 120 mg 3 times daily with meals. Liposuction, removal of fat by aspiration after injection of saline, has been used to remove the contour subcutaneous fat. However, it does not improve insulin sensitivity or risk factors for coronary heart disease. Surgery. Bariatric surgery is a treatment option for patients with severe obesity, BMI over 40, or over 35 if obesity related comorbidities are present. These are as follows: gastric banding. This is a purely restrictive procedure that compartmentalizes the upper stomach by placing a tight, adjustable prosthetic band around the entrance to the stomach. Gastric banding results in a less dramatic weight loss than RYGB and fewer short term complications. Frequent follow ups is required to adjust the gastric band. Roxanne Y gastric bypass, that is RYGB. Here, a small proximal gastric pouch is created and connected to the rest of the gastrointestinal tract via a tight stoma and a ROX-NY small bowel arrangement. ROIGB results in substantial amounts of weight loss. Complications include peritonitis due to anastomotic leak, abdominal wall hernias, staple line disruption, gallstones, neuropathy, marginal ulcers, stomal stenosis, wound infections, thromboembolic disease, gastrointestinal symptoms, and nutritional deficiencies. Vertical banded gastroplasty. This is a restrictive procedure in which the upper part of the stomach is partitioned by a vertical staple line with a tight outlet wrapped by a prosthetic mesh or band. It is often referred to as a stomach stapling operation. The small proximal pouch gets filled quickly by food and prevents consumption of a large meal.